All right, this is Marianne. Marianne, I asked you if you would tell your story because it is so powerful, about the story about how you were one day away from your surgical consult for a hip replacement. So first of all, do you mind if I show this video to other people or on our website?
No.
Is that okay? So tell us, first of all, what was going on with your hip and what showed on the x-rays and all of that?
Well, after about a year of my doctor thinking that I had an inflamed SI joint, she finally sent me to get an x-ray, a pelvic x-ray and a lower back x-ray. And my understanding was that on my right hip, the socket was smaller than my left socket, and that there was no more cartilage, or very little cartilage left on within that socket. And so it became abundantly clear that it was not an inflamed SI joint.
Right. So what were the symptoms that you were having back then?
It started out that I noticed that I had very decreased range of motion. I'm extremely flexible, and so I've always been able to easily get my heels up on my knees. And I started noticing that I would have considerable groin pain when I tried to get my right foot up on my left knee. And then the range of motion became more and more decreased, and I started having a lot of pain in my right upper thigh, both the front and the back of it, and lower back pain too.
Mm-hmm.
Lower back pain too.
And I remember when you first came in, you were in considerable amount of pain,
Right.
and had very limited range of motion.
Right.
And the x-rays did show that you had very, very thin cartilage.
Right.
And so your friend, one of my patients,
Mm-hmm.
said, you got to go see Dr. Harmon. And you came in, and one of the things that prompted me to get this video this morning is because you showed me a range of motion in your hip. So I would like to have you, let me just kind of zoom out here. Show us what you can do now.
Okay.
First of all, with the hip that's not been painful. That was normal.
Right.
And let's see what you could do before we started.
Before, probably, does this look about right, Dr. Harmon?
That's about how I remember
Probably
it.
what I could do. Now I'm sitting in a different chair, so, but now I can almost, get
gosh.
my foot up.
That's
And
awesome.
before, to have even attempted that would have caused considerable pain in my groin.
I remember trying to do your range of motion with your hip,
Right.
and how angry it got at me. Not you.
That's right.
Yeah. And so you mentioned that you were almost able to clip your own toenails now.
Right, right. Almost. I almost got my right foot.
How long has your husband been having to clip them?
Almost a year.
Wow.
Well, I think, and one of the things I'm sure your patients will recognize is that as we are able to do less and less and less, that becomes our normal. And so instead of just, I think because my physician was so certain that I had an inflamed SI joint and I just needed to keep doing these exercises, I began to feel that I was doing something wrong.
Right.
And when I started feeling, I just wondered what I was doing wrong, and I think it's normal when you feel like that not to do things like go and get a pedicure so that your feet look good. So I haven't had a pedicure in almost a year, and the exciting thing is I've only had 2 injection sessions. Only 2, Dr. Harmon.
That's right.
2
You
injection
have.
sessions.
So we've been doing Prolozone on your hip,
Yes.
right into the hip joint,
Right.
and some trigger points.
Right.
And then we did the Frankenhauser,
Correct.
which is the female reboot,
Right.
which is also very good for unresolved hip pain. and low back pain.
Okay.
Is there anything else you'd like to share? I know it's a very emotional topic, because when you came in, it was affecting a lot of areas
Everything.
of your life.
Everything. I guess the only thing I want to say is that I would encourage people to open their minds to something like this, because I was so narrow-minded when it came to anything outside Western medicine, that I was extremely skeptical. And yet, the fact that my friend said, oh, try Dr. Harmon, and it just fell that the appointment was the day before I saw my surgeon, who was very excited to do my hip replacement. I really believe that, I guess what I love the most, Dr. Harmon, is I feel for the first time in a long time like I really am a partner with you in my physical well-being, that my body is saying, oh, this is great, instead of just giving drugs to suppress or something, or just hacking into me, we're working together to heal me, and that's such an exciting
I really appreciate that.
idea, yes. So,
You know what's really ironic?
what?
Your friend
Yes.
did not even know that I do Prolozone.
That's right. That's right. And she said to me, Dr. Harmon will tell you if he can't help you. He will say, Mary Ann, you need a hip replacement, or he'll say, I think I can help you.
And that's what happened.
That's right.
Thank you so much, Mary Ann.
Thank you, Dr. Harmon.